Hi, this is Les Schaffer. I'm a scientist specializing in mathematical modeling and astrophysics, here to present this week's COVID This Week for the People's CDC. Here we see in the first slide for cases per million people worldwide that now Europe is showing quite a lot of cases. Australia and New Zealand have been high for quite a while, and we know that the United States and countries in South America have also been high, though not as high as the hotspots in Europe and Oceania. If we look at new deaths per million people versus vaccine doses distributed per 100 by continent across the whole pandemic, we can see that as vaccines have kicked in and uptake has increased, the death rate continent-wide has generally decreased, though it hasn't vanished. If we look in the last couple of months, worldwide, we see that the deaths have indeed dropped quite low, but that they haven't disappeared. In this regard, we should remember that vaccines can only limit serious illness and death. It does not produce sterilizing immunity. So people who are sick, whether it's asymptomatic or they know about it, can transmit the virus. Here we compare, again, globally and by continent, the number of cases and the number of deaths per million people. It's quite striking when we look at the cases that since this winter, when the Omicron variants hit, cases have been much higher than previously in the pandemic, although the deaths have been lower. And one way to think about this is that while deaths have diminished, we are breeding more variants by having the case rate so high for so long. So this is clearly unsustainable for the long term if cases remain this high. And also we should remember that when cases are high, since we know that some fraction of cases produce long COVID, which can result in chronic poor health for many, many months following infection, that when cases are high, there are still poor health outcomes amongst the population. In this slide, I picked out from our world in data, the few number of highest deaths per million. It's just to highlight what's going on in Europe now. Deaths are high by looking at the far right in Taiwan, New Zealand, Portugal, Greece, Australia, Brazil, United States, France, Austria, United Kingdom, Israel, and Canada. Of course, looking at these brown curves at the bottom, which represent New Zealand and Australia, brown and the blue curves, these two countries were able to keep their cases and deaths low for a long time in the pandemic, but because the pandemic circulates worldwide for so long, eventually countries can scale back up again. This is showing the same countries now for cases per million. Again, if you look at it on a logarithmic scale, we really haven't gone anywhere as far as cases are concerned. They're still high and higher than they were earlier on. And we can see by looking at the far left of the curve that we're nowhere near an outbreak just beginning. We are 4 or 5 orders of magnitude higher in cases. This is not a good way to end a pandemic. This is a pandemic that just keeps on roiling with new variants. Looking at the next slide, my main point here is about hospitalization data. This is from our world in data. I tried to look at the continent of Africa and South America. I took as countries the United States and Chile. So there's 4 curves in the upper left and lower right for cases and deaths. But you notice only 2 curves for hospital admissions and patients in ICU. And those are the United States and Chile that are reporting. Actually took some time to look through the Our World in data, and there's very, very little, much less than 5% of the countries are reporting what's going on in hospitals. Curious about this, I went to the WHO site, World Health Organization. They have no data on hospital admissions or patients in ICU. So a very critical piece of statistics worldwide is really absent from the data. This is a map of CDC county transmission levels for July 6th, last week. Red indicates the highest level of transmission. Yellow is moderate, blue is low. We can see most of the country 94% of the counties are in high transmission. If we look at it by population, greater than 99% of the population in the United States are living in a county that has high or substantial transmission levels. And just to note that these levels are determined either by positivity rates or by caseload. Sometimes a county measures one or the other. Here, we plot the cases, the deaths, hospitalizations, and the positivity rate across the pandemic for the United States. If you look at the bottom dark blue curve, we see that the positivity rate, which is an indication of transmission in a county, is high. It went as high as almost 40% over the winter and peaked around 20% in this last wave, is currently down around 13% nationwide now. It should be pointed out that any positivity rate in any county above 10% automatically makes a county high transmission. If we look at the cases and deaths, it appears that cases have gone up slightly in the last few months, but deaths have been level or decreasing very slightly. It's not clear if we are counting deaths properly, because I believe the CDC has no longer requiring hospitals to report death rates. On the other hand, if we look at hospitalizations in the last few weeks, we see hospitalizations going up. So once again, we're not out of the woods. This is a chart showing the progression of variants over the last several months. We can see the turquoise color in the bottom right, BA4 and BA5, increasing nearly exponentially. The other variants now beginning to recede. But clearly, as long as we are generating large number of cases worldwide, we will continue to be generating these variants. These variants have different properties in terms of immunity to vaccines and so forth. I did want to read one thing from Danny Altman, a professor of immunology at Imperial College, from his Guardian article, Where's the Herd Immunity? He says, also to be added to the now complex mix is immune imprinting. This is the finding that our immune response to COVID is shaped very differently depending on our private exposures, infections in one wave, and as an aside for various variants, relative to one another, plus vaccination. In our study, those who'd been infected in the first wave and then again with Omicron had particularly poor T-cell responses and no boosting of antibodies. That is, some combination of exposures may leave us poorly protected relative to others. And this speaks to the issue of claiming that we're all generating immunity by having so many cases for so long. This is not anything that can be of assurance to us. This slide shows wastewater data from BioBot Analytics, who's now the US vendor for analyzing wastewater. They have looked at the wastewater sites across the country and done some mathematical statistical averaging to give a value, a sort of an average value for what wastewater levels of COVID are in the country across the pandemic. That's in the dark blue, and they've compared it with the lighter blue, which are cases in the country. And they scaled it in such a way so it matches the first and the second waves, but clearly the Omicron and the current wave, we're clearly undercounting the case count by virtue of the fact that they've scaled it so that the wastewater matches in the first several peaks. So clearly we are still, as we know, undercounting cases, particularly because people are no longer doing PCR testing, generally speaking, but are using rat testing at home and not reporting it. The next slide shows weekly death counts in the US for 2020 through 2022 against an average of a previous 5 years, which is shown in gray. All this indicates this is not a count of COVID deaths. This is a count of all deaths broken up by age groups. Clearly, older groups are having higher excess mortality than younger groups. But in fact, whether you count COVID deaths from a hospital or you just look at the overall death counts as aggregated many weeks later, clearly deaths are still varying with COVID. This is a slide that indicates how COVID affects various ethnic groups differently. If we look at the top level of the charts, non-Hispanic white at the far left, and then non-Hispanic Black, Hispanic, non-Hispanic Asian, non-Hispanic American Indian or Alaskan Native, we can see that the percent change in overall deaths in 2022 compared to 2015 to 2019 is borne most heavily by non-white groups. Here's another slide that points more to inequalities and COVID outcomes. This is from a paper, The Color of the Pandemic, the association between historical residential redlining, COVID-19 outcomes in California. This is from May of this year. There's another article out similarly for New York City in June. On the far left of the graphs, we see San Francisco, Oakland, Los Angeles, and San Diego broken up by sectors. And green, blue, yellow, red indicates increasing risk for mortgages in various sections of the city. So the red are the highest risk. The yellow is the next highest risk. And if you look at the middle and the right columns, the middle column is COVID-19 cases in a brownish color, COVID-19 deaths in the far right in a violet color. You can see good correlation between the redlined areas of these cities and poor COVID-19 outcomes. This is a slide that relates to viral loads since PCR positive test for both Delta and Omicron over a 10 to 15 day reduction until there's a negative test. This data is also a function of whether you're vaccinated or not. It's from a paper that came out, New England Journal of Medicine, June 29th of this year, duration of shedding of cultural virus in SARS-CoV-2 Omicron infection. And if you look at this graph, you can see that viral loads remain high in a person and only decay to a low point well after 10 days or after. The CDC's new guidance is if you're positive, wait 5 days and then go back about your business. And clearly from this graph, the viral loads have not vanished. It's far better to wait the initial period of 10 days before one goes out and one should wear a mask. And the data also shows that some viral loads can run out as far as 15 days. This pictorial is from a paper, The Explosive Outbreak of SARS-CoV-2 Omicron variant is associated with vertical transmission in high-rise residential buildings in Hong Kong, coming out in August 2022. A variety of microbiologists, engineers, and architects studied some tall high-rise buildings in Hong Kong, trying to sort out how the virus spreads. And you can see in the left pictorial showing aerosols escaping from traps, wash basins, toilets, floor drains, and so forth. Those go upward in a stack, exit near the top of the building. And if you look at the right-hand picture for cases where there might be a COVID case at the bottom of the apartment, indicated in red, where aerosols can flow up towards the top and people get infected in the higher flats. So this is an indication that as we study more carefully how this virus spreads amongst people, whether you're indoors in the same house or you're outdoors, and now how the virus spreads from building to building in a high rise, we're getting a better handle on how transmission really occurs so that we can learn where do we need to have proper precautions in place so that we can prevent a drastic increase in the number of cases if somebody gets sick in a high-rise building or in a densely populated area. For more information, the website here is peoplecdc.org, peoplecdc.org/reports or info sheets. You can find more detailed information from our weather reports. We also have handouts, flyers, and sheets full of information about fighting COVID-19. Thank you.